I would say in the beginning, it was a lot of the unknown. We didn't know really what we were walking into, so we couldn't break those. We couldn't break it down for the residents because we didn't know ourselves.
The COVID-19 pandemic's impact on people with disabilities in Indiana. The Indiana Disability History Project interviewed people with disabilities and their families, as well as disability professionals and policymakers. Using video conference calls, the project asked them to talk about the ways COVID-19 impacted the lives of Hoosiers with disabilities. Spotlight on health disparities. The coronavirus brought with it an increased awareness of health disparities people with disabilities were facing before and during the pandemic.
Our healthcare system may not always be well prepared to make sure that the communication needs are addressed, that we have systems in place that allows them to participate through an accessible way, that that there's still a lot of implicit bias related to people with disabilities.
People with intellectual disabilities are 6 times more likely to die from COVID than the general population.
Because some of us have a lot of health issues that we were born with, along with getting this virus, makes it a whole lot worse.
People with chronic medical conditions are at greater risk of infection or severe consequences from the virus.
I have a tracheostomy, and I use a vent at night. I'm on a ventilator. I have muscular dystrophy. So all those things combined already seriously impact my lung function.
Individuals requiring care in a group home or in their own homes can be exposed to additional risk.
I have home health care, and a lot of my attendants were coming in here and telling me that they had it and they had been off work for so many days. And my agency never lets people know when their aides have come down with the COVID.
The National Council on Disability reports that patients who are medically fragile were at a much higher risk of being considered low priority for COVID-19 treatment. In making potentially life-saving treatment decisions, providers may assume that patients with significant disabilities have a low quality of life.
If I were to become sick, will I get the treatment? Would I be treated? There's always this anxiety in the back of, will I receive the treatment that I need if I go into the hospital because of COVID, because of the assumptions that may be made about me and to be quite honest, my value, my worth.
When COVID-19 vaccines first received emergency use authorization, Hoosiers with disabilities were not recognized as a priority population.
I was worried, and I didn't really want to wait until, the 60-year-old range. And I told her about my pre-existing conditions. I told her about all that on the phone. And she told me that she put me on a wait list. And she said, we call you about half an hour before. And I said, well, that's not going to work for me because I use paratransit to get somewhere. And even in my accessible van, because of my vision, I'm not able to drive it. And that wouldn't be enough time for somebody to pick me up.
Physical barriers, obstacles related to procedures, and communication barriers were common in both testing for COVID and vaccination.
No one thought about people with disabilities having a setup for people with autism, people with developmental disabilities, people with Down syndrome. I scheduled an appointment, got there early, and when I say early, an hour early, to explain to the staff that she had autism, she did not like shots, that, I would need help. Well, when it was her time to get it, all the people that I had talked to were gone.
The transition to healthcare through telehealth during the pandemic was a barrier to access to health services for some with disabilities and a welcome development for others.
It affected my health care because we couldn't go to our doctor's office for regular checkups. We had to do it online.
I love telehealth appointments. Some of the appointments, I would drive a total of 4 hours for a 15-minute appointment. That really could have been done over the phone.
As face masks became widespread, deaf, hard of hearing, and deaf-blind persons encountered barriers to communication. Masks make it impossible to lip read, and sign language is severely limited.
I recommend a clear face mask so you can read lips. I feel that most of the time, many things that I've seen, people who use face masks, I can't read their lips, I can't understand them.
Challenges to mental health. Along with the upheaval of the public health crisis, social isolation, loneliness, and loss of loved ones had a pervasive impact on mental health.
I myself and many other people with disabilities that are my friends who aren't really typically people that are depressed, have had to seek out professional help to deal with the emotions of all of this.
For those receiving disability services, daytime activities, work routines, and interaction with family and friends disappeared.
What I remember in the beginning, no one was able to leave. It was very locked down. I think it changed tremendously. It really flipped their day upside down.
There were painful losses due to deaths from COVID.
My husband was sick. I didn't know how bad. God knows I did not know. And she told me, she said, well, if Joe gets this COVID, he won't make it. Oh my God. Because I couldn't imagine my life, but I Joe, here's a man that I had married and lost for 15 years. And I'm thinking, oh my God. And that Sunday night at 8:40, he passed away.
Services and supports under stress. The pandemic strained the capacity of already stressed systems of disability services.
We have a lot of amazing people that work in the direct support roles. And in this particular pandemic, they often sacrifice their own families' needs to ensure that the people that they work with are safe, are healthy, had the things that they needed.
There were people also that stepped up and worked a lot of hours, to provide that care that those individuals needed. Some staff, they work some hours.
Many services were reduced or eliminated. A chronic shortage of direct care professionals got worse. In some cases, family caregivers had to step in and provide support where services were absent.
When the pandemic hit, I had no staff. The only staff I had was my mom.
Technology became a lifeline for people in a lockdown lifestyle. This trend heightened the digital divide for those with disabilities who are less likely to have broadband access, adequate equipment, or skills to use the technology. But for people with mobility disabilities or transportation barriers, new options to participate through video conference connection were long awaited.
We had a lot of anecdotal kind of stories, if you will, from self-advocates and families and therapists of them telling us how beneficial the telehealth opportunity or the technology used to provide and receive their services and supports was very much a mutual beneficial type situation.
Although remote learning had positive outcomes for some, the National Council on Disability found that students with disabilities were neglected during the pandemic. Overall, they did not receive the in-person special education services that make learning possible. Early childhood education and services critical to early development became scarce.
The other kind of challenge that I identified, I think, from a big picture, is early intervention, or really that key time for early intervention for an infant or toddler that has a disability or has a developmental delay, that 0 to 3 or even 0 to 5 kind of time period, to make sure that we are identifying any types of needs and making sure that we can get them the early intervention, kind of those critical milestones early on is huge. And I do in general have some concern for maybe some of those missed milestones during those COVID-19 pandemic years.
Families took on new responsibilities for ensuring their children's education.
He did pretty good. I had to be with him all of the time. I had to monitor him and make sure he stayed on. It was hard to keep up with all the changes, plus working from home and then trying to homeschool my daughter.
The pandemic had a significant impact on employment for people with disabilities, who have been underrepresented in the American workforce for decades. During this time, they faced additional job losses.
When the pandemic started, and I was laid off work for 6 months. Me being off work for that 6 months kind of drove me a little crazy.
Health disparities, low priority for vaccination, social isolation and loneliness, loss of loved ones, a strained system of support, unemployment. Hoosiers with disabilities experienced serious challenges during the pandemic. However, many of those barriers are not new, just more apparent. In their persistent struggle for disability rights, people with disabilities have faced obstacles with creativity and resilience. Some have seen silver linings in the cloud of coronavirus. The greater accessibility, long overdue, offered by online events, meetings, classes, and especially telehealth. Will these gains be lost as the pandemic wanes?
We don't want to go back to the so-called normal. Our normal, we've been fighting against that. We don't want it to come back to that. We want to make it better. You figured it out when the pandemic demanded it. We've been demanding for 30 plus years.
For the future, COVID-19 has given us both a challenge and an opportunity to learn, to plan, and to advocate for change. Produced by Indiana Institute on Disability and Community, Center for Health Equity, Indiana University, funded by the Indiana Governor's Council for People with Disabilities. Copyright 2022, the Trustees of Indiana University.